Hello, this project was done by Jamaica Chapman, Asha Harris, Michaela Wells, and Candace Sharp. And on our first day of clinicals, we had an NG tube clog. And us, as well as the nurses, were all confused on what the best way to unclog this clot was, whether it be enzymes, warm water, and some even suggested Coke. We decided that this is a serious clinical issue, and we decided to study what in patients with NG tubes and PEG tubes, what is the best practice for preventing clots in comparison to no care. We started our search at Sanal, where we looked up keywords like enteral tube, PEG tube, education, clogged feeding tubes, and we made sure it was in English and it was a research article. One of the first articles that we researched was Intensive Care Unit Nurses' Knowledge of Medication Administration via Entera Tools. This was a non-experimental descriptive research study that was about 1,080 ICU nurses in Izmir, Turkey. This level 3A research article had crazy research findings. This article was mainly trying to find out what these ICU nurses, how they were actually performing medication administration. There was no experiment necessarily. It was just trying to find out what they were actually doing. And the research and the findings was crazy. The findings included that 58.8% of nurses would put enteric-coated capsules through the NG tubes. 42.9% of nurses did not stop the enteral nutrition when performing medication administration. 52.6% of nurses give liquid drug, which is what you're supposed to do. But it's sad that 48% of nurses weren't doing that. 71.3% of nurses would just crush the medication and put it through the tube, not diluting it with liquid. All of these errors would increase the likelihood of getting a clog in the tube and hurting the patient's safety.
For article number 1, a quasi-experimental design was used. The aim of the study was to evaluate the effect of an educational program on nurses' practice related to the care of patients undergoing nasogastric tube feeding. It also aimed to design, implement, and evaluate an educational program. The setting was in an intensive care unit at a university hospital in New Damietta City. Subjects of the study included 30 ICU nurses. Study findings show that the implementation of an educational program for nurses caring for patients undergoing nasogastric tube feeding significantly improved the nurses' total level of practice. The overall quality level of my article is a 2A because it is a quasi-experimental and it's high quality.
Article number 2 was named Quality Improvement of Oral Medication Administration in Patients with Enteral Feeding Tubes. The goal of this study was to educate nurses to use other ways other than crushing pills to administer medications to patients with enteral feeding tubes. The results of this study showed a decrease in the number of tube obstructions in hospital number 1 with the integrated educational program, and a significant decrease in the number of administration errors per nurse in hospital number 2. The article I chose was given a 2B rating. It also the sample size consisted of 28 patients total, 12 in hospital 1, 16 in hospital 2, 17 nurses in hospital 1, and 19 nurses in hospital 2.
Garrison study was a quasi-experimental study that tested the most effective ways to clear a clot. They used 3 different methods: an actuated mechanical device, warm water, and an enzyme. The results were based on the total nursing time it took to clear the clot and the effectiveness of clearing the clot. The results were that the mechanical device was the most effective way to clear the clot in both categories. Next was the enzyme, and then the least effective way was the warm water. I thought this was an interesting finding because UCMC's procedures use warm water to clear the clots, and that is the least effective way and found in this experiment.
The overall quality of our evidence-based practice project was a level 3B. All research study findings were consistent with previous research.
The findings from our research do not compare to current clinical practice because it was found that a mechanical actuated device is the most effective way to clear a clot, and UCMC uses warm water, which is actually the least effective way.
Recommendations from our research articles show that nurses should be educated on better ways to unclog enteral tubes and NG tubes when giving medications. We should find liquid medications. If there are any, consult a pharmacy, and these would lead to positive outcomes in clinical practice because nurses wouldn't have to rely on crushing medications to administer to patients and causing clogs in NG and enteral feeding tubes.
The implementation of our study findings and conclusions would cause an increase in patient safety and a decrease in the incidence of clogged tubes.